Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. The modified Gillet or Gillet test in tree pose. The purpose of the modified Gillet or Gillet test, however you prefer to pronounce it, in tree pose is to simply screen for gliding, as you're seeing I'm demonstrating here, of the ilium, where my hands are now, over the sacrum, or the inferior lateral angle of the sacrum to be exact. So we're looking at the possibility of sacral dyskinesis, abnormal movement, and the general kinetic movement of the ilium over the sacrum. The process is to grossly palpate and identify the medial inferior posterior sacroiliac spine, the PSIS, and then move from the PSIS to the ILA around the S2 tubercle roughly, while the patient will lift the ipsilateral hip. The ilium should flex and move medially and inferiorly with hip flexion. You can also have them switch to the other side to see the reciprocal movement. The test is positive if no movement is observable as we compare to the other side, palpating the medial inferior PSIS of the ilium and the ILA of the sacrum. The patient flexes the hip again, and the test would be positive if no movement is observable as compared to the opposite side. And again, I always have them test modified tree on the opposite side to check for reciprocal movement. Thank you for joining me.